Module 18 will cover kinesiology in cancers, and the physical activity guidelines for cancer survivors. Most of the contributions of kinesiology to our understanding of cancer mechanisms come from exercise physiology. Research laboratories around the world have focused attention on how the exposure to physical activity may block key steps in the multi-state carcinogenesis process. Biomechanical and behavioral factors, although important, have not been identified as central to the mechanisms of physical activity that affect the development of cancer. Then, what physiological adaptations may be mechanisms by which physical activity may affect cancer risk? Answers may vary but include the following: avoidance of weight gain or weight loss, reduced insulin resistance, lower systemic low-grade inflammation, lower colon transit time, lowering production of sex hormones, and improved immune function. Is there a benefit to being physically active after being diagnosed with cancer, perhaps during and after treatment? With improved cancer treatments and earlier, more effective diagnostic techniques, more and more people are living with cancer. In 2009, an estimated 11 to 12 million people in the U.S. were living with cancer or had survived a bout of cancer. Then, how can physical activity participation affect cancer survivors? In general, cancer survivors who engage in physical activity and exercise can reduce their risks for new chronic diseases, and participation may reduce the adverse effects of cancer treatment. What are the scientifically observed health benefits of physical activity among cancer survivors? A cancer diagnosis is a difficult situation filled with many psychological and physiological changes as a result of both the disease and the therapeutic regimens used to control the disease. Chemotherapy, radiation, and surgery are standard cancer treatments, and all can negatively affect the body in the quest to reduce or eliminate a cancerous tumor. Hormone therapy and steroid treatments that accompany some cancer treatments can also have deleterious effects. Issues such as fatigue, lymphedema like localized fluid retention secondary to radiation therapy, cardiorespiratory fitness, muscular strength and endurance, quality of life, self-esteem, and safety like risk of adverse events are most important to cancer survivors. Participation in physical activity can help in the management of cancers, and emerging evidence gives substantial credibility to the belief that physical activity programming should be part of cancer survivors' therapy. Here are some considerations for interventions in preventing and treating cancer. Cancer survivors are at increased risk for several comorbid conditions, and many seek lifestyle change to reduce dysfunction and improve long-term health. To better understand the impact of cancer on adult survivors' health and health behaviors, a review was conducted by DeMark Wanifried and colleagues in 2005 to determine 1 prevalent physical health conditions, 2 persistent lifestyle changes, and 3 outcomes of previous lifestyle interventions aimed at improving health within this population. The researchers found that many patients were not be active enough pre-cancer, and had reduction in physical activity levels on diagnosis. The intuitive medical advice for the patients was to take it easy, therefore the patients were less than 1/2 physically active return to pre-diagnosis levels. Cancer survivors are at increased risk for progressive disease but also for second primaries, osteoporosis, obesity, cardiovascular disease, diabetes, and functional decline. To improve overall health, survivors frequently initiate diet, exercise, and other lifestyle changes after diagnosis. However, those who are male, older, and less educated are less likely to adopt these changes. There also is selective uptake of messages, as evidenced by findings that only 25% to 42% of survivors consume adequate amounts of fruits and vegetables, and approximately 70% of breast and prostate cancer survivors are overweight or obese. Several behavioral interventions show promise for improving survivors' health-related outcomes. Oncologists can play a pivotal role in health promotion, yet only 20% provide such guidance. With 64% of cancer patients surviving over 5 years beyond diagnosis, oncologists are challenged to expand their focus from acute care to managing the long-term health consequences of cancer. Although more research is needed, opportunities exist for oncologists to promote lifestyle changes that may improve the length and quality of life of their patients. Here are some barriers to physical activity engagement. Physical activity is not part of cancer treatment plan. Lack of clinical trial data of physical activity and survival. Reluctance of oncologists to prescribe physical activity. Lack of prioritization of physical activity in healthcare setting. Non-availability of insurance coverage for physical activity counseling, and confusion from patients on whether physical activity increases survival. The levels of physical activity and exercise associated with cancer risk reduction can be attained by following the 2008 Physical Activity Guidelines for Americans as described for cardiorespiratory health. Broadly, the physical activity dose should be the same as population guidelines, and the cancer survivors should avoid inactivity. A reasonable amount of evidence indicates that a dose-response association between physical activity and a lower risk of developing colon or breast cancer, which is consistent with the recommendation of 30-60 minutes of moderate to vigorous intensity physical activity every day. Data for this effect are strongest in relation to aerobic leisure time physical activity. Data supporting the effect of an accumulation of short bouts of physical activity and exercise on cancer's risk are currently limited. A small body of strong evidence suggests that breast cancer survival is associated with participation in regular physical activity and exercise. Therefore, the risk of colon and breast cancer can be reduced by participating in at least 150 minutes of moderate intensity physical activity per week. Cancer survivors who engage in physical activity and exercise can reduce their risks for new chronic diseases, and participation may reduce the adverse effects of cancer treatment. What physical activity and exercise guidelines can reduce cancer risk? The amount recommended is the same for cardiorespiratory and musculoskeletal health. Adults should engage in 150 minutes of moderate intensity or 75 minutes of vigorous aerobic activity per week, or an equivalent of mixed moderate intensity and vigorous intensity aerobic activity. They should also try to participate in muscle strengthening activities involving the major muscle groups on 2 or more days per week. Then, how much physical activity and exercise is needed to reduce cancer risks and improve the quality of life for those who survive a bout of cancer? A reasonable amount of evidence indicates a dose-response association between physical activity and exercise and a lower risk of developing colon or breast cancer, which is consistent with the recommendation of 30 to 60 minutes of moderate to vigorous intensity physical activity or exercise every day. Cancer survivors who engage in physical activity and exercise can reduce their risks for new chronic diseases, and participation may reduce the adverse effects of cancer treatment. Cancer survivors should consult with their healthcare providers to verify that their physical activity or exercise plans are consistent with their current physical abilities and health status. There are many side effects of cancer treatment, such as fatigue, pain, nausea, mouth sores, lymphedema, peripheral neuropathy, radiation dermatitis, constipation, diarrhea, infection. Mode of activity, falls. Therefore, there are some considerations for the mode of activity and exercise program. As a result of disease, some patients may have weakness to their bones. Those with disease to the pelvis or lower legs should avoid high-impact exercise and may benefit from seated exercise such as cycling or chair exercises. Exercising in the water may also be an option for these individuals. Water-based activities will be suitable for some and not for others. Those with intravenous catheters, nephrostomy tubes, and urinary bladder catheters may not be able to use a pool, but those with indwelling central venous catheters, continent urinary devices, or colostomies may be able to. Additional considerations are also available. An exercise buddy system that pairs up a novice survivor exerciser with a more experienced partner can provide support and improve initial adherence to any program. Identifying barriers to exercise and jointly devising some strategies to overcome these barriers can be an efficient use of time at the start of any exercise program. There are also psychosocial benefits from the regular participation in physical activity, such as improved mood, enhanced self-esteem, and better sense of control. In addition, physical activity engagement is beneficial for the functional independence as well.